I want to talk to you just for a couple minutes about vitamin D3. You know, I go to all the medical conferences and I try to stay up to date on all the medical literature. And all these conferences I go to, they say that we as North Americans were markedly deficient in vitamin D3. So I come back to our medical practice and I started drawing levels on everybody. I drew my own level and it came back 15. Now normal, according to both labs, Quest and LabCorp, is somewhere between 30 and 100. So 15 is really low. That's not where you want to be. Most of my patients are coming back somewhere between 10 and 25. Again, this is super low. You want to be somewhere between 30 and 100. But to be honest with you, you know, I always say normal is not optimal. I need to get you as close to 100 as I can. Now, vitamin D3. Vitamin D3 is a hormone, but our body doesn't make it like testosterone, estrogen, progesterone, thyroid, DHEA. Vitamin D3, most everybody knows, comes from sunlight. But even if you lived on the beach at the equator, you're not going to get the sunlight you need for good health. Now, for many, many years, we thought that vitamin D3 was only necessary to regulate the absorption of calcium in our bones. You see all the advertisements for Wonder Bread, build strong bones, build strong bodies, vitamin D3 in milk. But again, this is not going to get you where you need to be. In the last 7 to 8 years, with today's technology, just like all the other hormones, they've been able to discover that every cell in your body has receptors for every hormone, including vitamin D3. Here's what we know now. We've always known that it helps decrease the risk of osteomalacia, which is soft bones, decrease the risk of osteoporosis, which are fragile bones, helps keep calcium in the bones. But now we know that it might help reduce the risk of multiple sclerosis. It decreases your chances markedly of heart disease, decreases your chances of catching the flu every year. It markedly increases your immune system. Low levels are also linked to cancers of the breast, colon, prostate, ovaries, esophagus, and your lymphatic system. And there's mounting evidence that vitamin D will even lower your blood pressure. These are things we didn't know in the past. I'm very excited about this, and I'm telling all my patients when they come in to see me, I really believe that this is what's going to keep us out of the nursing homes. I tell my patients all the time that my job is not only to make us look good and feel good now, but I want to markedly decrease our risk factors for disease in the future. And I also don't want to increase our lifespan, I want to increase our health span. It doesn't do us any good to live to be 100 if we're going to be sick. And I think vitamin D3 is going to play a big role in this. Now, if you read some of the magazines, and some other doctors will tell you that you're probably getting a sufficient amount in your multivitamin, they're wrong. I'm telling my patients they need to take 10,000 international units every night before they go to bed. Sounds like a lot, probably is, but I want to get you as close to that 100 as I can. You can overdose on vitamin D3, but not at 10,000. Again, I had 2 guys come in here last summer, tan, they were boaters, and they said, we don't need vitamin D3, we're out in the sun all the time. I did their levels, and they're down in the lower 30s. So you don't want to be at the bottom of that curve, you want to be at the other side of the curve, close to as you can to be at 100. And I'm recommending that you go out, and it comes in 5,000 international unit capsules. Take 2 of those every night before you go to bed. I hope you've learned something about vitamin D3, and have a great day.